Hello everyone, welcome to the channel. Today I'm thrilled to introduce you to Medhive, a next generation healthcare platform built specially for migrant workers in Kerala. In this video, I'll walk you through its features, architecture, and how it empowers different stakeholders, workers, employers, providers, and public health system. So let's dive in. There are several key roles in the system. The first one is the migrant workers. The main user who carries a QR health ID, consents to data sharing, and views personal health records. The second one is the employer who can sponsor the worker's health profile, view compliance, and screen results. The third one is the healthcare provider who can record medical interactions and share treatment history. The fourth one is the government who can run analytics, outbreak detection, and policy planning. The last one is the admin who can manage access, overseas, and deployments. So, firstly, we will be signing in as a migrant worker. So, here you have to choose your role as a migrant worker and continue. Then, you have to add your number here and then click on send OTP. You will get the OTP on your phone, which you have to enter here and then continue. Here you can see different features are available such as registration and identity where workers can verify their identity using KYC, Aadhaar card, passport, OTP or even face verification. A QR based health ID is generated after completion. Then the health profile which stores all details like demographics, employment, medical history, vaccinations, and risk factors. Then comes the AI alert, which gives important risk warnings, reminders, and even shows a color coded health status. Then the preventive care, which helps with vaccination reminders and a health calendar. Then the emergency and telecommunication, which gives quick access to ICE contacts, important information, and remote doctor support. Then the multilingual and accessibility, which supports multiple languages, pictograms, and a voice-friendly design. Let's sign in as a employer. So choose your role as a employer and click on continue. Then put your email ID and password and click on sign in. Right at the top, you can see the company details. Here, it's ABC Construction Company with its unique company ID and license number. This ensures transparency and authentication of the employer. Next, we have a quick dashboard overview showing important workforce statistics. 247 total workers registered under this company, 231 active workers currently working, 16 pending verifications that may require documentation or health updates, and a strong 94% compliance rate showing how well the company follows regulation. Below that, we have different sections like worker management, health overview, reports, and compliance. Here, we are in the Worker Management tab where employers can track each other's health and compliance status. In the Worker Dictionary, employers can search workers by name, ID, or position. For example, we can see Rajesh Kumar, a mason, whose health status is verified, vaccination is complete, and he is at low risk. His contract is valid till June 30, 2025. On the other hand, Suresh Babu, an electrician, has pending health verification, partial vaccination, and is marked as medium risk. These color coded indicators verified pending, complete, partial, low risk, medium risk make it easy for employers to quickly check compliance and take action where needed. And with the Add Worker button, new employees can be registered into the system instantly. So, in short, this portal gives employers a complete 360-degree view of their workforce health compliance, helping them ensure worker safety, meet government regulations, and build a healthier work environment. Similarly, we can also sign in as a healthcare provider, government, and an admin according to our role. So, suppose If we are signing in as a government and then click on continue, we can see a dashboard which appears. So right at the top, we can see the big numbers 342 active cases are currently being monitored. But look at the fantastic progress on the vaccination coverage. It's at 92.6%, nearing the 95% target. The high risk district section immediately flags 4 districts needing immediate attention, a crucial early warning. Below, the case trend chart clearly shows up how cases versus vaccination are progressing over time, which is essential for policymakers. And for anyone wanting to dive into the raw data, there's a great feature up here. Just click on the Export CSV button on the top right and you can download the entire dataset for your own analysis. Now let's look at the standout features. Blockchain security. The system uses Hyperledger Fabric to ensure that records are immutable, auditable, and permissioned. QR Health ID system. Every worker is assigned a unique QR based health ID. This QR can be used at clinics or health camps to fetch or store records securely. AI analytics and surveillance dashboard. Aggregated anonymized data is used for trend detection, outbreaks, and health forecasting. Offline first PWA. Even in areas with poor connectivity, the app works offline and syncs when connectivity returns. Multilingual support. The UI supports Malayalam, Hindi, Tamil, and English, making it usable by many migrant communities. Consent management. The worker controls which role, provider, employer, government can access which parts of the data. Consent is explicit. Along with managing workers and compliance, the portal also comes with a very useful feature and integrated chatbot that helps workers resolve their issues quickly. This chatbot works like a digital assistant. Migrant workers can simply type their questions or select from suggested options. For example, if we ask the chatbot to show the record, then the chatbot is asking us about what kind of record. So we will add lab record and the chatbot shows the latest lab records of the migrant. We can directly download the record by tapping on download button. If we click on the dashboard in the navbar, we can see the visualization of the data. Firstly, we can see the active workers currently registered, then vaccination coverage across all districts, health alerts, health trends which are lively monitored and predicted. Here's a visualization showing cases over time. Here's the top conditions which are affected to the migrants. Here is a bar graph showing cases by district. And here's a health status distribution of the migrants which shows the number of healthy migrants, the number of migrants which are under monitoring, and the number of migrants which requires attention. If the user clicks on health record, he or she will be able to add new record here and also see the previous records which he or she have registered in the portal. And in the analytics section, we can see all the analysis of the workers, like the active workers, health alerts, vaccination rate, risk score, AI insight, and health trends, etc. Nexite's digital health record management system empowers migrant workers in Kerala with secure, accessible, and portable health records. Using cutting edge blockchain, AI, and multilingual support, our platform ensures timely healthcare, early disease detection, and complete patient control over data, all aligned with sustainable development goals. Together, we are transforming healthcare accessibility and equity for vulnerable communities. Join us in building a healthier future. Thank you.